Hi folks, this is Tom at engineersfordoctors.org. This is the first of two videos made by an engineer for doctors to help explain some of the subtleties around the anatomy of masks and respirators, which you might not have had to have thought about before, but now that there's a mask shortage, everybody's trying to scramble to get the right masks from the right suppliers. And we're just here to tease out some of the jargon. This video is going to be about masks, and check our other video for respirator type work. Okay, so introducing masks. These are basically cotton/paper filters in a cup. I'm going to call it a cup, I don't know the right term for it, but in a cup there with a valve, a nose piece, a nose pad, and a strap. The strap is attached with staples just there. Put our masks on, adjust them. Your employer will show you the correct procedure for donning, adjusting and removing a mask. That isn't what this video is about. Please adhere to your employer's guidance there. But you can see that essentially once I've got it on, there's an airproof gap around there. Right. And very steamy glasses. Let's talk about mask sterilisation. There's a lot of speculation and processes emerging in the pandemic to deal with reuse of disposable masks like this one. And we thought it'd be helpful to go through maybe some of the materials considerations. You'll notice that masks like this have a strap. This one is made of elastic with some kind of cotton fibre there. This one here is made of essentially a rubber band. Straps are almost always secured on with a steel clip there, like a staple. So if you're in the business of sterilising your masks to essentially make a limited stock go further, you need to be careful that the process that you use doesn't denature the strap. For example, UV light aggressively attacks elastopolymers like elastic and like rubber. The last thing you want is your mask strap breaking during an examination. Similar consideration needs to be made for the mask clips here. These are made out of steel usually, perhaps stainless steel in the better quality masks, but almost all steels will be degraded very rapidly and go rusty and then fall to pieces with exposure to bleach, chlorine and chemicals like that. So just be very careful if you are sterilising masks using either UV or chemical practices. You need to monitor the quality of the straps and replace them and replace the staples if they're going bad. Right. Next, the nose clip. Don't forget, this is usually aluminium, some of them are plastic, and of course you've got the staples, which are a metal component. If you're proposing to do things like put masks in a microwave, you might want to consider that that's actually a bad idea because of these metal components. You end up with shorting and arcing in the microwave, which is not safe at all. So maybe not the best idea there. And don't forget, you've got a foam plastic pad here. Certain chemical agents may dissolve that. So again, take care that the nose pad isn't degrading if you're using some kind of chemical-based sterilisation. The cup itself is made of paper or cotton, and if I turn this is a fairly old mask that I just use for DIY. If I turn this inside out, you'll see that actually over multiple uses it's formed kind of cracks and pivots. It's not nearly as effective as it used to be, okay? So if you're attempting to sterilise these disposable masks and then reuse them, be very careful please to inspect that the actual structure of the mask hasn't degraded during the process, because obviously it needs to maintain integrity for it to be an effective filter. Boiling masks in water for a long time, approaches like that, will tend to actually just disintegrate this material here, which is useless in the end. Coming on to this component here, the valve, is made of some kind of plastic usually. Not all masks have valves, by the way. Masks like this one is a simple DIY mask. You can tell it's a DIY mask because it's filthy. Obviously doctors should be using clean ones. Masks like this don't have an exhaust. Actually, higher grade masks like this one, which is an FFP2 grade mask, will have exhausts, and most of the masks that you're looking for here as doctors should be FFP3 masks or better, which will have plastic exhausts on them. So the exhaust has that plastic part there, and it has this rubber insert. If you push the rubber, essentially it allows air out, but if you try and breathe in, it doesn't let air in, which is what forces the air you're breathing to come through the pad. Because that's rubber or some kind of elastomer, again, if you're using something like UV to try and sterilise these, you need to always test and be sure that actually you're not denaturing that component of the mask. Same goes for extreme temperature type work as well. That's an important component to keep working. If you're getting problems, that plastic will become brittle, or that rubber will become brittle over time. It will stick, and then you're just breathing in the air from the patient anyway. And I think that pretty much covers it, except for, regulations will vary from place to place. Here in the UK, my understanding is that doctors will want FFP3 masks. Always check with your with Public Health England or your employer to ensure that information is up to date. But you'll find that the FFP2 in this case, or FFP3 branding, is usually printed on either the valve or, for example, in this case, just right onto the front of the mask. And again, in the UK, at least doctors should always be using masks with the CE mark there. Hopefully that's been a good and useful overview of some of the aspects that you might want to think about while you're actually attempting to sterilise masks. And from engineers to doctors, good luck out there.